From bowl to bowl, dank to tank, or just the eloquent weed be poopin'. Yes, I'm going to use all of the weed and poop puns that I possibly can, because when else am I going to be able to use them? So today's video is something that you've been asking me a lot about, which is, why does weed make you feel like you need to poop? And let me just say, all of my 8 years of post-secondary education, including a PhD in neuroscience, has led me to this point, and I'm not even upset about it. So this is actually a more interesting question than you probably expect, because it kind of goes counter to what we'd actually hypothesize. So a lot of people in my last videos about weed have been like, yeah, but like, why does weed make me poop? So like every time I smoke or every time I take an edible, I feel like I have to have a bowel movement. And this is a thing that a lot of people don't talk about. So I'm going to talk about things like constipation, diarrhea in this video. It is a thing that like is not commonly discussed. So if I asked you how often somebody has a bowel movement, would you be able to give me an appropriate answer? Like one that is within a normal range? Maybe, maybe not. We have a pretty severe stigma against talking about these types of things in places like the United States, but all across the world as well. You may have heard of the idea that coffee makes people more likely to poop, but what about weed? So like, what is specifically happening here? So the thing is that people say that increases the likelihood of them having a bowel movement, but in actuality, it should do the opposite thing. So what we see is that CB1 receptors, so the receptors that cannabinoids like those found in cannabis, that those bind to, those are found in places like your GI tract, and those seem to be linked to gut motility. So basically how quickly something moves through your system. And what they find is that the CB1 receptors, when you increase activation of those, like weed supposedly does, that actually decreases your gut motility. So it actually kind of makes it slower to move through your system. This is contrary to what people are saying online. They're basically like, yeah, but weed actually makes me poop more. And that is actually true in terms of what we see when we do the research. So when you ask people about their bowel movements and their weed use, you see that there is actually a connection between more weed use and less of things like constipation. They did this like big study with like 10,000 people to actually see how weed is linked to things like constipation and diarrhea and just like bowel movements in general. And so they asked 10,000 people basically about like their drug use. They didn't ask anybody over the age of 60. I don't know why. They said like, obviously we didn't ask them. What is obvious about that? Do you assume that people over the age of 60 don't use drugs? Like, what is happening here? Anyways, they asked everybody, except for people over the age of 60, about their weed use as well as their bowel movement. So they asked them to basically like imagine their last poops. What did they look like? And they had the scale of 1 to 7. And I'm going to give you this scale because, again, we barely talk about this. So this is a thing that I feel like people should know the basics about. So they basically said that like 1 and 2 on the scale were bad and 6 and 7 on the scale were bad. So if you're between 3 and 5, you were relatively good. Those were normal bowel movements. So a 1 on this scale was like basically like rabbit pellets. So like nut, very tiny drops. Number 2 was also bad, which was sausage-like but lumpy. Sorry, I'm going to ruin sausage for a lot of people after this, but not my fault. This is the scale used by the scientists. Number 3 was like a smoother sausage, just a couple of cracks. And number 4 was more like a snake. And number 5 was also okay, which was soft blobs with clear-cut edges, which sounds like an impressionist painting, but those between 3 and 5, those were normal. And then 6 and 7 are in the diarrhea range. So 1 and 2 is constipation. So 6 and 7 were things like mushy, ragged edges, basically liquidy. Then they also ask them about how often they pooped. So they're basically like less than 3 times per week constipated. More than 21 times per week, you have diarrhea. But anywhere between 3 and 21, that's normal. The answer to the earlier question is literally anywhere between 3 and 21, which is a very wide range. What they found was that regular weed users, like within the past month, were far less likely to be constipated. Like 30% decreased odds of constipation if you were a regular weed user. But they found nothing with diarrhea, and they found some interesting differences that you saw with people who were just regular weed users in general. So they were more likely to be male, they were more likely to be younger. They were either more likely to have lower levels of education or higher levels of education. So not really in the middle, but like you have a PhD or you didn't graduate college. They were also less likely to be overweight, but they were also more likely to eat like calorie-rich food, fat-rich food, sugar-rich food, things like that throughout the day, and also less fiber. Obviously, we see that things like diet are associated with things like constipation, but in terms of this high fat, high protein, high calorie, high sugar, high everything diet, probably not the best for like regular GI movement. Like, here's the thing, that is all correlational data. So people who are more likely to have used are also less likely to be constipated. But that's not telling us about what weed is actually doing in terms of like GI motility. And we have very little out there on that. So most of what we have is what y'all are telling me, like, oh, weed does this. And yeah, we don't really know why. We are now doing more research into this because we think that things like weed might actually help for things like IBS. Like they might actually be relatively good in treating some of these disorders. And in general, like we do see that it helps with things like nausea and vomiting too. Unless you have kind of high potency chronic use over very long periods of time, which then might weirdly lead to cannabinoid hyperemesis syndrome, but we have no idea what's going on with that as of right now. But like when you think about it in terms of like, oh, can help with nausea and vomiting, but also maybe long-term leads to cannabinoid hyperemesis syndrome, but then like maybe makes people more likely to poop, but then also should slow gut motility. We don't really know what's going on. Like this is a lot of just confusing science.